Making every contact count, it's about helping people to make behavioural changes which can improve their health. And it's based on a competency framework that's been developed nationally with the support of a wide range of organisations, including local government, NHS organisations and the business sector as well. The framework has 4 basic levels, and they range from just giving brief advice to somebody and signposting them to services, right the way through to delivering a specialist behaviour change service. The framework's based on the NICE guidance for behavioural change, and what it recommends is that we use all opportunities to promote health and well-being and to give people the skills to say, well, if you're concerned about your health, how can I help you to find out more about how you can improve your health? And that might be through referring somebody to a specialist service like a stop smoking service or a weight management service, or it might be about signposting them to an information service. The examples of work that have been undertaken to date include settings like mental health, voluntary and community organisations, hospital and acute settings, as well as local government and primary care. And we're looking to develop a framework across Rotherham which involves all the partners, including all of those organisations, in looking at ways in which we can support local people to improve their health and well-being, but also to really improve the health and well-being of our staff and the people who work in our organisations.
Can you tell me a little bit about your Making Every Contact Count journey?
We started talking about making every contact count in 2009, and this was on the back of the Lord Darcy review, Transforming Community Services, where he said that all frontline staff should be promoters of health and well-being. And what we did, we looked at developing a health promoting workforce project. This was a 1-year project supported by Public Health in Derbyshire. We had a very small steering group. This consisted of Tracy Allen, our Chief Exec, Maureen Murfin, who started the Health Trainer programme in Derbyshire, and Sue Cohen, who was a consultant in public health for Derbyshire. And what we did, we set up some workshops, and we looked at engaging our staff in this project. These were staff nominated by heads of service as change agents, people who would drive this project forward. So it was very much a top-down but bottom-up learning experience. And this is what influenced what we did in the future in terms of making every contact count. And from those workshops, we developed the training plan and the action plan for how we would take it forwards.
What was the reaction like across the different workforces when you started to deliver MECC?
Our staff were really enthusiastic about it. Once they understood what public health was all about, they understood about health inequalities, they really wanted to make a difference. And this has really shown in what we now do in our services. And this has really changed attitude, it's changed culture within our organisation, and it started to influence our policies and our strategies.
How did your organisation in Derbyshire resource Making Every Contact Count?
Initially, it was a joint funded collaboration with Derbyshire Community Health Services and Public Health in Derbyshire. Now we have a sequin around it. We had a sequin in 2012-13 and we have a sequin for this year as well. And this enables us to really focus our resources on delivery of making every contact count within Derbyshire.
Have you seen any unexpected outcomes along the way throughout your journey?
What has been interesting is the difference it's made to our staff, certainly our staff health and wellbeing, and they report such wonderful changes. What we've had is reduced cholesterol levels, we've had reduced blood pressures, staff have taken up more physical activity, they're eating healthier, and that was really an unexpected outcome from this, the impact that it would make on our staff and them looking at their own health and wellbeing.
And what are your top tips for us in Rotherham to start to deliver our own MECC behaviour change framework?
I think what you have to have is real top level support for making every contact count, but this is really about working in partnership. You have to work in partnership with your staff, with your managers, with your leaders. You have to work in partnership with your health promotion services and your healthy lifestyle services, and that's where the difference can be made.
Can you tell me a little bit about your Making Every Contact Count journey?
We started about 18 months ago, and we worked predominantly with our colleagues in Stockport who had done some work with Making Every Contact Count. We'd looked at developing a package, if you like, for all staff in the council. So what we're very aware of was that it didn't really fit the whole range of jobs within the council. So whether you're a planner or a housing officer, or whether you worked in social care, and that could be across the city. So what we knew we had to do was adapt and develop what we were doing. We had a key project plan for the whole of the project, and we developed a pilot in the early stages and we got sign off from the council leadership team. We did a fairly small pilot to begin with in the Resources Directorate, and we worked with cleaners, catering staff, occupational health and Revenues and Benefits Service to just trial some of the materials that we could use. It wasn't a pure training session that we developed. We developed a number of communication methods to use with teams, whether it be newsletters or a series of toolbox talk briefings around some of the key areas that we were looking at. So it was the journey started off really as part of the pilot, where we tested out the materials and tested out whether what we had was right for the organisation and for the city, because we did work with some partners as well. So that's really where we started on the journey.
And how was the reaction amongst your workforce when you started implementing Making Every Contact Count?
I think initially it's been received very well. Wherever we've gone, it's been received really, really positively. And I think what in Leeds that we've done, we've focused on three particular areas. We've focused on frontline workers and senior level champions. So we've done a lot of work with senior leadership teams across the city. So we have a forum called Leaders for Leeds, where we've done some work. We've also worked quite proactively with members as well, who we see as strategic leaders across the city. So the Health is Everyone's Business sort of development has been broadly received by all leaders across the city, not particular pockets just to Leeds City Council. We then began to look at frontline staff, and we developed a series of different interventions for different groups of staff. There wasn't really a one sort of level fits all. It was very, very different.
How did the organisation resource the framework?
What we've had to do is it was a joint partnership with public health. So the HR service at Leeds City Council and the public health team jointly supported it with staff. We didn't have a budget. We've not worked with a budget. We've just worked with staff. So what we have done is we've built an infrastructure across the board. So we've also developed around about a number of workplace wellbeing champions as well that have also supported the project. So what we've tried to do is to build an infrastructure based on some of my colleagues in HR, based on the public health team, and also with our wellbeing champions. And everything we've done has been within budget, from the rooms, the development of materials, promotional things. We've done a DVD, has all been within the budget that we've had. We've not had a separate project team. This is just a very, very small part of my job and other people's.
Have you seen any unexpected outcomes when you've delivered Making Every Contact Count?
I think what's been interesting about the outcomes, very much from a raising awareness of health and wellbeing services within Leeds, and how to signpost people. That's been a really critical one. We found that particularly in our Revenues and Benefits Service, there were some benefits that they weren't aware of, so we've made sure they've been signposted across the board. We use a card system that's linked to Leeds Let's Change in the city, which is a public health funded service, and we have a referral card that tells us where people are being referred from, and we've seen an increase in the numbers of people referred to services from Leeds City Council. So that's been an interesting one. I suppose an unexpected one is it's very much from an employee wellbeing development area. So it's about our employees' health and wellbeing, but also their role in spreading key messages around health and wellbeing to the communities of Leeds. And I think what we didn't sort of plan for, I suppose, was the fact that staff have also gone away and sort of spread those key messages to family and friends as well. And those have been some, I suppose, outputs that we didn't expect. And those have been quite interesting, the numbers of referrals from family and friends that have come into services as well.
So what are your top tips for Rotherham and for delivering Making Every Contact Count here?
It's to be aware that one size doesn't fit all. We've done quite a lot. We're beginning to move now into locality working, which seems to be working really well. So rather than working with groups of staff, we're working in localities with particular sort of areas of need. So, for example, where we know smoking prevalence is higher, we're bringing together sort of different services right across the board. It could be third sector, it could be business, it could be the council, it could be schools. So I think what we're really trying to do in Leeds at the moment is not work in silos, but bring everybody together for a particular area around health and wellbeing, and that's particularly within workforce across the board. So I suppose we're doing a lot of work there. It's not a one size fits all. The Making Every Contact Count framework doesn't fit every staff. It was predominantly there for health workers. So I think what you've got a framework to work with and adapt it. Because of where we are at the moment in the economic climate, you can't release all your staff all of the time. So some of it's about key communication methods as well, but also looking at more innovative things. We've just produced a DVD that we're going to use for managers for team meetings, so we can get some of the key messages across to managers at team meetings. And I suppose those are some of the things that I would say from a Rotherham Park point of view, is to go in there very open-minded and to think about meeting the needs of different staff teams, particularly those hard-to-reach groups across the city.
The main issue that we got into talking about was the number of people we're coming across now that are really struggling with fuel poverty, and how we could actually use this approach so that our technical operatives that are probably visiting somewhere between 40,000 and 60,000 times a year our customers could actually take the opportunity to talk to those customers about how they could tackle fuel poverty, energy efficiency, making sure they're getting the right benefits, etc., and those sorts of things. Now, our guys are clearly going in to mend the boiler or put a bit of plastering in place, or they're not going to talk about those issues, but we could quite easily put in place a system where they could pick up those queries and give people some basic information about that, about how they could go and find out more detailed information and get some real help.
We want to promote everyone in Rotherham to live more active, more healthy lives, and this is one of the ways that we're going to be able to do it.
We've heard today two great examples of how Make Every Contact Count can really make a difference to people's lives in terms of their healthy lifestyles and interventions, brief interventions, to really bring about change. And also improve the health of the workforce and their families. So I think it's very important for us in Rotherham that we look at how to take forward Making Every Contact Count. Making Every Contact Count can deliver the ambitions of the Health and Wellbeing Board in improving the health of the people of Rotherham, and we really need to make every effort to take the initiative forward.
We need to help people improve their whole life experience and be able to be more healthy, and they'll just all live longer and feel happier for it.
We've seen some examples now of how behaviour change has been industrially scaled in organisations in Leeds City Council, but also in Derbyshire Community Health Services. It's given us some real food for thought and some ideas about how we might do that in Rotherham now. And through workshop participation and discussion, we've come up with some ideas about how our local partnership can work together to initiate this kind of programme locally. It's really important that we take this opportunity to improve the health and well-being of our communities, but also of our staff, because our staff are part of our community. Many of them do live in Rotherham, and it's an opportunity for us to seek ways in which we can improve their health and that of the families and communities that they serve.